Hi, I'm Dr. Kathryn Dao. I'm reporting the ACR 2022 meeting for Room Now, and I have a very special guest today, Dr. Patrica Dhar from Ascension Medical Group in Michigan. Welcome, Dr. Dhar.
Hi, how are you?
Good. I'm so excited that you're here with me because you have studied something that is near and dear to my heart and that is so under spotlighted. I mean, like people don't really talk about it, and that's sexual health. And so your recent abstract is on a novel method to screen for cervical cancer. Could you give me a little bit, and our audience too, a little bit of a background as to the genesis of this project?
So I've sort of been working on this for many years, and it started many years ago when I was at Wayne State, which I'm still clinical faculty on in Detroit, where I was noticing that women with lupus were having abnormal pap smears. So we looked at this and we realized that the risk for abnormal pap smears, mostly dysplasia, was markedly increased compared to the general population. Um, and these are women that are immunosuppressed. And at that time, there was no vaccine. So we looked at HPV and found that HPV was latent and not actively being transcribed. It was a small study where we looked at formalin fixed tissue and we did HPV genetic analysis, and we saw that there was DNA, but there was no RNA, so it was just sitting there. And we also looked at integration, did not find integration. I was expecting to find integration, and we did not find it in that small study, but that was on formalin fixed tissue. So that led to another study, and I was very lucky that Merck decided to support an investigator-initiated study where we actually looked at the safety and immunogenicity of Gardasil vaccine in lupus. And um, we were at that time, the indication was only up to age 26, but my thinking is women are sexually active most of their lives. They remain at risk for HPV. I'm sorry, my dog's barking. So I apologize for that.
Fine.
They remain at risk for HPV. And why can't they get the vaccine after that? Because maybe they were exposed to one type and not the other. So we asked for in the grant that the vaccine women be allowed to get it up to age 50. So then it was initially a phase 3 where we were going to look at really sick patients that were immunosuppressed and look at immunogenicity, but the FDA got involved because it was outside of the indication, and they turned a phase 3 into a phase 1 trial, and then it doubled the budget, but they were nice enough to fund it. So we completed that study, and then I decided to kind of look more at HPV. So that led to, we did a couple things looking at vaccine uptake, and we published on that, showing that there's low uptake. And so when I transitioned to Ascension, was still affiliated with Wayne. I've kind of switched jobs around here in Detroit. So it makes it difficult when you're switching jobs and trying to do research in one area. So submitted this grant to Blue Cross because I really wanted to look at HPV a little bit more and start looking at latency and integration and looking at while I was doing the study, I'm like, do I really want to bring women in for pap smears? And I have a great team at U of M, Dr. Carey and Dr. Heather Walleen, and they were doing cervical brush samples for an oral cancer study. And so we looked into that, and I actually contacted the manufacturer in Amsterdam who provided these brushes free of charge for me. So that was a way to bring women in, didn't have to do a pap smear. They could teach them to how to use the brush, and they would do self-sampling. So that's how the study got funded. It was a team effort. And then um, there was a new head of the Mott Center at Wayne State, where I had worked before with my mentor, and he was interested in vaginal cytokines. And I said, well, why don't we look at mRNA for vaginal cytokines? So I'm just lucky, and I had a great cytopathologist at Ascension, Dr. Fathala, who we put it through. I said, I want this to be handled exactly like we would handle a normal pap smear specimen. And so it was handled just like that. And nobody had ever read morphology off of a brush sample. So we didn't have any reference. So we found out we were able to read morphology, but there weren't any quality indicators. And so I said to my cytopathologist, well, if there's no quality indicators, does that really invalidate the reading? She goes, no, it's better to get a, a frequent PAP without quality indicators than not get one for 5 years with quality indicators. So, that's sort of the team that I work with.
So when you mention quality indicators, what are they routinely looking at to
So they're
determine that?
Yeah, so they're looking at if the sample comes from the os, the endocervical region. So when
Mhm.
you have the brush, it's just brushing the cells that are shed into the vaginal vault. It's inserted like a tampon. So it's very easy for women to use. But you don't necessarily, when you do a pap smear, you actually put the sampling spatula or brush in the os to get the endocervical cells. So that's sort of high quality. So we got that in a few samples, but um, so that's a limitation, but more frequent monitoring with maybe a less sensitive method is better than no monitoring at all for high,
Mm.
especially for high grade. And I was surprised that we actually picked up abnormal cytology with this method. So that was something new, that you can read cytology after this with using this method. So that was kind of exciting for us. Um, and then I didn't have the HPV analysis done when we submitted the abstract. So I just added it to the poster. And we were just surprised. We saw multiple HPV types in women, including non-traditional types like HPV 90, which is becoming now considered a high risk type. So it was very similar to what has been seen in the HIV population. Again, it's probably more of a function of immunosuppression. And a lot of these women did not know they had had an HPV infection. And when you talk to these women, they're high risk, right? African American
Right.
women are higher risk for cervical cancer. They have higher mortality. African American women with lupus also have higher mortality. So it's a double disease burden for them. And they're not getting PAPs on a regular basis. The insurance only covers it every 5 years. It's just not on radar. And
No, no. And not
yeah,
only that, I mean, like there were some recent guidelines about how you should treat immunosuppressed patients like HIV patients for getting cervical cancer screening. And I don't
yeah.
think that rheumatologists know that. They're just following general ACOG guidelines, but our patients are immunosuppressed and should be screened regularly.
Yeah, and the fact that they have multiple types and multiple partners, and it's just kind of like it's spreading STDs both ways. So, a lot of the women were not in this study. And, condoms are not acceptable in some populations. And so I was curious to look at that. Most of these women were not using condoms. They didn't really realize the link with HPV and the other related diseases. It's a matter of teaching these women how to take care of themselves and making them aware, because then they can advocate. Okay, maybe the doctor can't keep track of everything, but maybe they can advocate for themselves and say, I need a pap smear. I would like a pap smear, and I need to use a condom. I'm not using it for pregnancy prevention. I'm on birth control, but I need to use a condom to protect myself, because once HPV gets into the cervix, you can't get rid of it. And I think it doesn't really go away. I think, there's a second peak of HPV when you get older, and people would think, oh, these older women are becoming more sexually active. But I think some of that might be reappearances of the vaccine as you get older. There's DNA demethylation, and you get dysregulation of the immune environment in the cervix, and this HPV can go from latent to active transcription. So we're actually working with U of M, and I have some wonderful investigators at the University of Arizona, Dr. Anderson, who's looking at non-neutralizing antibodies, and Dr. Moore is looking at vaginal cytokine, and Heather Walline again, and even Chad Brenner now at the U of M. And we're putting together a project. I had to shop around to find which agency was interested, because it's sort of not your traditional, there's a control population and this and that. It's really hard to do that with lupus and this kind of study. So I wanted to have two purposes of cervical monitoring, where we do brush samples and we study the biology, what is happening. We look at the vaginal cytokines, we look at the HPV viral load, we look at their immune suppression. And in this trial, I want to offer them the vaccine as part of an option. So with lupus patients, you can't force treatment. You know, you have to be very hands-on with them. You have to really make them understand what's going on, because they don't trust the healthcare system a lot of times. And so it takes a while to build bridges. Most of the women were in this study were my patients. And so they're you know, I've built some trust with them, and always make sure that I do things ethically and don't put my patients at harm. And the ethical thing with this study was that I called every patient and told them what their result was. But then the caveat was, this is a research lab. I can't report this to your doctor. Please go in and see your gynecologist and get a pap smear, because we did find, you know, 3 or 4 HPV types. You should be using a condom because you've been infected with HPV. So that's the limitation of research studies. It's not a CLIA approved lab, so you can't really report it. So part of what we discussed for this future project, is there a way we could report it? We may not be able to, because CLIA approved labs are limited with the types of HPV they can test. So we may still just have to call them and inform them. And part of the thing is with education, do they accept the vaccine over time?
Right.
And so, you know, it was really hard to find an agency that would say, okay, because they usually want, you know, with the NIH cancer branch, which is where I fit, they wanted more of a hypothesis driven control group. And I'm like, I don't need to waste money on controls. I need to study the biology and offer these women vaccine and educate them. So I did find the one branch, the disparities branch of the NIH, which is friendly to this type of a concept. So we're going to move forward and, you know, keep your fingers crossed. It's always difficult getting funded. So
Yeah, no, that's great that you're doing this. And so in the last minute that we have, I wanted to have you give our audience like tips on how you approach this topic with your patients and how they can integrate it into their practice.
So first of all, we have to take away the stigma from HPV. Everybody gets exposed who's sexually active, but I always tell my women with lupus, you know, you can get HPV and you can get cervical cancer just by not protecting yourself. So why not protect yourself and get checked and tested? So a lot of these women, a lot of it is education. Use condoms, even if you're on birth control, use condoms to protect yourself. You will not have symptoms until it's late, and the insurance may not cover pap smears with the frequency that you need it. And the HPV testing only covers 15 high risk types, and we're seeing a shift to other HPV types. And once HPV gets in your system, can't get rid of it. It sleeps in your cervix forever. I don't think you really get rid of it after 2 years. I think it's like shingles, or it sleeps in your system. So I try to educate them. And when I've changed jobs and I've come back to where my patients can come to see me, it's so funny. Some of them will tell me, I did everything you would have told me to do. I told my doctor to give me a pap smear. I told them I needed an echo. I told them I needed a vaccination. So it was really nice. I think just having a relationship where they trust you and they know you're trying to advocate for their health, and then training them to take care of themselves, because we're there with them for a short time, but they really have to learn how to take care of themselves. And it's not me giving orders, it's me talking with the patient and empowering them that you have this knowledge, you have the ability to take care of yourself, you know, close the vault, you know, protect it. Don't let anybody in the house that you think is not going to be good for you, you know. And a lot of that, you know, these are young women, they're vulnerable, they're depressed. Sometimes people take advantage of them because they want to be loved. And so, you know, it's easy to take advantage of these women because they're very vulnerable and depressed. So part of what I try to do is empower them that, the power's in your hands, protect yourself, you deserve better than this, you deserve to have somebody who cares about you, who doesn't mind using protection to take care of you. So part of that, part of my passion is teaching women to take care of themselves. And while we monitor them and we're giving them monitoring with this future study, hopefully we're educating them. So when they leave the study or they go somewhere else, they know how to take care of themselves. And in this day and age, you have to advocate for yourself.
That
If
is
you don't,
so important.
yeah,
Absolutely.
if
Yeah,
you don't
absolutely.
advocate for yourself, you can't depend on the doctors to do anything. Doctors aren't aware. So another part of this future study is Ascension's been wonderful. They're going to disseminate doctor education through the whole system if we get funded. I'll tell you in a year. If we don't get funded, I'll be depressed for a year. But anyway, I was so
No, thank
thankful that I'm so thankful that Blue Cross funded me. I just like, because this is the kind of study people are just like not aware of it.
Yeah,
And
that was
with
they
all the,
brush it under the rug.
yeah,
So,
they do. And, COVID
yeah.
took precedence. And I was so excited. I said, I got funded for a non-COVID study. Wow.
Well, thank you so much for spending the time talking to us. I'm going to really share this with everybody that I know, all the rheumatologists, all the nurses and healthcare providers and the patients. And, I just love your study and we need to collaborate in the future. Thank you so much.
Thank you so much. I really appreciate your support and getting it out. I really do appreciate your interest because usually no one's interested in what I'm doing at these meetings.
So this is Dr. Kathryn Dao reporting for Room Now. Please follow me on Twitter and follow Dr. Dhar and email her if you want to collaborate.
Sure, absolutely. I'm all for that.
Take care.
Take care.